Hello and welcome to LTC Heroes podcast by Experience Care. I want to give a little bit of context and background to my next guest, LaShuan Bethea. She's the executive director at the National Center of Assisted Living. She and I met at the Georgia Healthcare Convention 2 or 3 weeks ago, and I was really excited to run into her and get to hear her speak at the convention. And so to have her on LTC Heroes and talk about her background and also the big challenges that she is facing at NCAL is a real honor. LaShuan, welcome to the program.
Thank you. I am very happy to be here. So thank you for having me.
So I've spent some time researching you and your background, and it is very interesting. You look about 15 years younger than me, but it seems like you have about 25 more years of experience. Will you take me back to the first days? I always call this part kind of like the long-term care the long-term care first steps or first impact. How did you get into long-term care?
Sure. So you know what? It's interesting because that's my favorite question to ask other people as well. I'm very curious about, how people, ventured into long-term care. Tell me a little bit about their journey. So I'm very happy to share mine. I think that, I, as a young child, a young person, I didn't, think that I would work in long-term care. And my first exposure in long-term care was actually while I was in high school. I was fortunate enough to have a licensed practical nursing program in my local high school, and having the desire to be a nurse. I went through that program and I had some of my first experiences in the long-term care setting when I was in high school. At that time, my thoughts were that, I'm going to, work be a student in long-term care. I got to know the types of individuals that we care for in the long-term care, setting. And when I graduated from high school, I thought I'll continue to work in long-term care, not thinking I would be there permanently, but looking to get more experience is what I originally thought. I'm going to continue to work in long-term care. So I went and worked in a nursing home within my community, and I fell in love with it. I saw my ability to use the skills that I learned while I was in school to impact, the individuals that I was caring for. I built relationships with, my residents, with their families, and I just found it to be very rewarding knowing that, the outcomes of the people that were in the nursing home were dependent on my skill and my ability to communicate effectively with them, to assess them and communicate with, their doctor. I did try a lot of other, areas, because I did go on. I think you may alluded to this earlier, that I, from there, I went on to become a registered nurse, and I did try a variety of different areas, from emergency room nursing to behavioral health nursing. And even then I worked on a geriatric psychiatric unit at some time, but I always continue to keep one foot in long-term care, finding that that's really where my heart was and where I felt like I was, most impactful. And so, from there, I, continued to work in long-term care, but I eventually went back to school to become an attorney. And so I don't want to, should I keep going on my story?
You're doing fine.
Okay.
I'm going to interrupt you.
Yeah.
I want to stop and I want to go back to a specific memory. Maybe it was your third week working in a nursing home. Maybe it was your 6th month. Back when you were in high school, is there a specific resident or a specific moment that always sticks with you, and you remember it viscerally? Your body was like, oh, that was special.
Absolutely. So I'll tell you, when I went to school in high school, I feel like my teachers they were really tough on us. I mean, they impressed upon us the value of what we brought to the table in terms of our skills, and how important it was not to minimize, our role in patient care and outcomes. And so what I will tell you is that that stayed with me. And so one of my first jobs, I remember just thinking about my role, how, if I'm working in long-term care specifically, we don't have physicians that are there on staff to kind of assess the residents every day. It really is about the nurse's skill and ability to assess the residents and communicate effectively with the physicians. And I remember one of the first times I had resident that wasn't doing so well. And it just, I remembered my teacher saying, it's your skill, it's your ability to assess. And I went in, and I assessed the resident, and I found some things that were abnormal, and I effectively communicated it with the doctor and was able to get that resident treated appropriately. They did not go out to the hospital, which is something that we work effectively to prevent. But for me, that day, I think that I not only gained the respect of, that week, I think I not only gained the respect of the resident and their family, but also the individuals that worked around me, because I was fairly young. I graduated high school. I was 18 years old, and now I'm working as a nurse. And pretty much everyone that I worked with was older than me. And so here I am, in this environment. And I think that I also had that challenge of trying to figure out team dynamics and how do you work with people that are, have an age difference than you and may not be accustomed to having an 18-year-old be able to kind of determine the path of that, of that unit. And so I recognized that I had to be able to not only work with this team, but also show that I could be a leader. And I think that day that I was, those decisions that I made around assessing that resident, effectively communicating with the physician, the respect that I gained from the physicians, even shortly thereafter, I think also was recognized by, my peers, the individuals that I work with. And so there, it just kind of implanted in me that my role really is important, that my job is important, and, building a team, that everyone plays a role. So I think that memory happening very early on in my career, it was something that I went back to time and time in other jobs that I had as well, about the importance of teamwork, about the importance of collaboration, and the importance of your role, in the healthcare continuum, that we all have a specific role that's important.
Given that your initiation in long-term care was so young, I want to take a small tangent. I just interviewed about an hour and a half ago a 16-year-old girl who just became a CNA. And one of the things that I've tried to use this platform for is to help the staffing crisis and bring as much attention to some of those intangibles about what's special about long-term care, and get some of that younger generation, get them interested in it. And so I'm glad, because your comment lines up with hers. And I want to ask you, given that you did the same thing that she did, if there's a 16-year-old or an 18-year-old LaShuan out there right now who is in Tennessee, or she's in Virginia, or she's in California, and she's going to listen to this, what advice would you tell her why this industry is special?
So a couple of reasons. I think it's rewarding every single day. When you go into a facility, or when you go into a community, in the assisted living setting, and you're working with individuals, every interaction that you have with those individuals is rewarding to them, and that you get to see that benefit. You get to see them smile. You get to know that you're making an impact in your life, and in their life. And I think it's important not to underestimate that exchange of you're doing something from them, but seeing them receive that and being appreciative of that, is rewarding. I think so. That's one thing. I think that two, I think that there are so many opportunities in the long-term care, space, from, being an entrepreneur in the space, which I think is something that we don't talk about enough, the pathways for how someone can be an entrepreneur in the long-term care space. But there's also so much career growth. As you mentioned, I ask a lot of people about their journeys in long-term care, like, how did you get there? And I meet so many people that started as a housekeeper, as a dietary aide, as a CNA, and they are, many of those people are owners and operators, administrators, directors within the profession. And so it really is a gateway in terms of opportunity. You don't have to stay stagnant. And I think that we could do a lot more to tell people about the different career paths that exist within long-term care. And I think that, overall, this is an area where I think that, we as an industry can do a lot more in terms of, bringing more workers in, showing them the different career paths, explaining to them the different opportunities, but also doing some mentorship and partnering individuals who may not be in the profession, and showing them the different things that we have in terms of, different experiences that we have. So
What you just said, I haven't put it in those words. You said two things. One is the reward that you receive and the reward that you're giving the other person is fantastic. But the other thing that you said is you lined up with a previous guest that I had, Diane Powell. Diane Powell is, she started off as a CNA, as a single mom, became a nurse, director of nursing, administrator. But then you're going to like this because you mentioned entrepreneurship. She then created her own education institute, and she trains, I think, close to 40% of the CNAs in the state of Kansas. And that's where I did my CNN training with her. So you hit all 3 points in one comment. I appreciate that. LaShuan, kind of moving on, I'm interested in the learning curve, right? You have diverse background. You're an attorney, a registered nurse. You started off young, as we've just mentioned, but becoming the executive director of one of the 3 most important associations in long-term care in the entire United States, NCAL, couldn't have been easy. And you did it right in the middle of COVID. Can you tell me your first month, what was the hardest thing for you to get acclimated? Was it learning names? Was it understanding the bureaucracy? Tell me what your challenge was.
So I would say that I recognized early on, well, I think I should back up probably a little bit, that, I am in the industry, so I'm not foreign to it. And so I felt making the transition to the executive director of NCAL, there were lots of familiar faces. So lots of people that I knew there, and that made the transition, I think, easier because I knew a lot of people both within the organization, but a lot of my peers now would be working with, but from a different perspective. And so but from that, taking all that in mind, I knew right away that I really needed to talk with people. I needed to meet with all the board members, and we're a federation. So we have state affiliates in, all of the states. And I knew that I needed to meet all of these individuals in order for me to understand what is most important in the industry, what the priorities were, because I didn't want to do that in a silo. I think working within the industry, I think one of the things that we always want to be mindful of is that we don't think our own perspective is the only perspective, and that we recognize that everyone has different experiences, and we need to bring those experiences in so we can make sure the path that we're taking is the correct one. And so I would say the biggest challenge is, the time that I knew it would take me to meet all of the people that I needed to meet and get their perspectives so that I could, make a determination about what are the priorities and make sure that NCAL is focusing on the things that are most meaningful, to providers across the country and the individuals that they care for, but also for the individuals that work in these environments as well.
Can you give me an example? And this is completely out of curiosity. Can you give me an example of what are the range of interests of a priority in one state versus a different priority in another? Just for, I think the audience, it's going to be, if not everyone's worked in a national organization like you have, understanding that what's happened in South Dakota might be completely different than what's in Florida.
So you know what, I'm not going to tell you any surprises here. And I'm sure you're probably going to guess, the number one priority is workforce, hands down. I think that trumps, everything. And really, because it has such an impact on access, there are providers across the country that, are not able to take individuals into their communities because they don't have the workers to care for them. And in some cases that impacts what's happening at the hospital. It impacts, what's happening in the residential communities in those areas. And so, I would say the number one priority of everyone is how do we recruit and retain, workers. And so that is that is the number one item, across, all the states, I would say.
In terms so when we get to priority like 5 and 6, where there's not necessarily alignment or agreement, what are some of the differences from a geographic point of view?
Yeah, so I would say, if I would say that some from I guess one of the things I would bring up is maybe the regulatory differences, that regulation differs from some states. Some are more significant than others. And I think that one of the things that COVID has done has, state, I guess, governmental agencies have looked at assisted living and tried to look at like, where are there some needs there? And in some cases, they may have applied what is happening on the skilled nursing side to the assisted living side. And for those that work in the industry or that have worked in assisted living and worked in skilled nursing, they are very different. And so there might be some governmental agencies that might not be as aware of these distinctions. And so to apply the skilled nursing regulations to an assisted living environment when it is very different can be sometimes a little bit challenging for the assisted living. And so that is happening in some of the states where, those regulatory changes have happened where I would say that's one thing. I think
that makes sense. You obviously have, some state where there is a significant amount of compliance and another where they just don't have it. And you have to deal with both of those priorities at the national level.
Right. Absolutely. And we support all of the states, what they're doing. But we focus primarily on the federal regulation, federal legislation, federal advocacy, but we absolutely do support the states and what they're doing. And I think I mentioned this earlier, but each state is very unique. The regulatory environment, what can and cannot be done in assisted living varies drastically from, state to state, even in terms of the types of individuals, the payment structure, it is different from state to state. And that's why we have those 50 affiliates, because they are subject matter experts in those state specific nuances.
Well, LaShuan, in the last year, let's see, you've been the executive director almost 10 months now. Does that sound right?
Almost 6.
Oh, okay.
Or just about. I think I just crossed. Yeah, 6 months.
So let's modify this. What's the Proudest Initiative that NCAL's done in the last 6 months?
Last 6 months, I would say, well, I think we have been doing a lot around, I would say, promoting vaccination, making sure that assisted living, communities have access to vaccines, making sure there's education around vaccine awareness. We know that having access to vaccines is one of the most significant things that had an impact in our industry in terms of the tragic loss that occurred early in the pandemic. And so if I had to look back on the last, 6 months or so, I would say that, again, making sure that the providers, the assisted living communities in general, have an understanding of the importance of vaccine, the impact that it could have in our community. I think also access to testing as well, making sure that assisted living communities are included in any distribution of testing supplies that have come out from the government, making sure that they are included in those. Sometimes I think that, skilled nursing and hospitals are on the radar. And so we want to make sure that assisted living is also on our government's radar when they are distributing critical supplies like testing, or they are planning for how vaccines are going to get to residents or employees of assisted living communities. So I would say those are probably the two most impactful to our assisted living members and again, the individuals that live in those communities as well.
Before we move on, I want to just take a moment to thank the people who introduced us, LaShuan. I appreciate Mindy from Georgia Healthcare Association and Tony Marshall. That's the reason that we met in Georgia. And also thank the sponsor of LTC Heroes. LTC Heroes is sponsored by one of America's oldest and best EHR companies called Experience Care. Go over to www.experience.care/guarantee. LaShuan, this is always the uncomfortable question that I ask, especially important executives like yourselves, where I ask you to brag about yourself. I ask you to take off your humble hat. And if you had, your best girlfriend around or your mom was around and they said, what have you done lately that you might not tell everyone, but you're really proud of? Can you think of something that you haven't shared with everyone? Maybe your mom or your girlfriend, you'd be like, I did this well in the last 3 months and I'm really proud of it.
Am I limited to the last 3 months?
No, not at all.
Okay. So, one of the things I think my personal friends and family are aware of this, but I think, in general, people are not generally, aware. I would say that my probably proudest moment was, graduating law school. But I feel like there's some context to why I'm, proud of that, accomplishment. I would say that, I was a young mom. I had my first child at 16. And I think that that's important for, young people who might be listening and thinking, wow, if you have a child at 16, it could be it could be difficult, and it is difficult. So I don't want to minimize,
Right.
that. But I think that looking that I started there and that I was able to achieve becoming a nurse and then becoming an attorney, at the moment when, I participated in my graduation with my children there, I think I look back at, where I started, where I began my, career, and the challenge that I had. And I, was very proud of that moment. And it's one of the reasons why, I feel like mentorship is so important, because I think that when you are in these micro challenges in your life, you might think that that's the end if you go through something that's really difficult. But I have lots of little micro challenges in my life that I think it's important for me to share those journeys with other people who might be also having micro challenges, to know that it's a moment in time, and it's about planning. It's about having a support system, even if you have to create it on your own, because it's, again, a micro challenge, and you at one point will be able to look back on that and say, it just made me stronger. It made me develop the tools and resources to get over. So, I would say that, graduating law school was that moment where it all just came together for me. That the little things that I did along the way, the times that I fell and I got back up, it all led me to this moment.
I appreciate you highlighting that, because it made me feel really proud of you. I am a father, and I can't imagine finishing law school right now. Can you take me back to that moment of happiness? Maybe it was the graduation day, or maybe it was the next day, or maybe it was your last class. Do you remember what you felt? Who you told? What was going through your mind and your body?
So I'll tell you that I have an interesting story. It took me a couple of times to pass the bar exam, and that's a blow to my ego, because I'm a type A diligent student that always does really well academically, and law school really challenged my ability to think I was the smartest person in the classroom, because when you're in a room full of smart people, someone is going to not be at the top of the class. But you learn to kind of check your ego at the door and keep pushing forward. And so when the bar exam results came out, my name was not on the list the last time that I took the bar exam. So of course I was completely devastated. And I remember I was speaking at a conference for the Pennsylvania Healthcare Association, actually, and I just went back to my hotel room after speaking, and I got a call from a 202 number. So I took the DC bar, and I thought, it's got to be someone important. I don't really know a whole lot of people that live in DC, so I'm going to answer this call. And it was someone from the bar examiner's office telling me that there was a mistake and I actually had passed the bar. And so I, of course, had a heart attack right there in my room. And I was so glad that I took that call in my room. I think it was divine intervention that I didn't take that call anywhere else, because I was not my composure was not one that should have been exposed to the public. And I think I kept this person on the phone for probably 10 minutes, while I just kept repeating it and just making sure that it wasn't a dream. And then I immediately, called my significant other and called my family. And I said, you won't believe this. I said, but I'm not really sure if I dreamt it or it's real. I said, so just know that I'm going through this kind of experience right now, and I'll let you know later if it's real or not. It was an exciting moment for me, but of course had all this color around it that I'll never forget. It's part of my story. But I'll share one other moment with you. So during, my graduation, my family came, and, my uncle and my mom is there, my children, my significant other, other family members are there. And I have a picture, and I look at that picture because, when I look at that picture is really when I formed that thought about how proud I was of all that I've accomplished. But more importantly, what can I do with that story? What can I do with that journey to inspire other people to overcome their micro challenges, to know that whatever your goal is, whatever you want for yourself, it's really about the process. It's really about, getting back up and continuing to move forward.
I'm going to ask you what you learned from the professional side of becoming an attorney, but I want to stay right there for a moment. I want to try and envision, what did you do in the hotel room? Are you a dancer? Did you scream out loud?
Oh my goodness.
Did you hold one hand up in the air? Did you turn around in circles? What'd you do?
I like jumped up and down. I screamed and I had to calm myself down because there's this other person on the phone, and I'm sure that they expected some type of reaction, but I was, hyperventilating a little bit and I just had to collect myself. And I think I asked her, okay, let's say it one more time. I think I said that probably 10 times because I really wanted to hear it again and again and again. I just wanted to make sure she had the right person and, all of that. And then I was so scared to hang up with her because I thought, if I hang up, is this like moment over? Is it really real? Even thinking back, I kind of get a little bit chills about it, because I still kind of didn't believe it until I saw they posted another updated file and my name was on there. And that's when it really was, this is real. I'm an attorney. Well, I had to be sworn in, of course, but
right. So for anyone who's listened to this on the podcast platform and not watching us, I think it's important to emphasize, I think that there are certain types of people who live off the energy of other people and they get excited. My father is that way. And so when LaShuan, you're telling me the story, I'm bouncing my knee like you're telling me this, and I'm getting the vibe and it makes me so excited. So I hope someone can watch the video because this has been a cool moment that you shared with me. LaShuan, from the professional point of view, I know that you've been in government relations, in policy and governance for a long time, but you become an attorney, you had to pick up some extra insight into how to have a bigger impact at the national level. What was it about having an attorney mindset that allowed for you to be a better job as an executive director today at NCAL?
Sure. So I think one of the earlier things that I learned is about the entire process. I think that early on in my career working in long-term care, I really did not understand why we had to do what we had to do. I didn't understand that the policies and procedures were built upon regulation, and those regulations were, proposed and then final, and that the stakeholders had the ability to be able to comment and give feedback. I didn't really understand that, some of those regulations are based on laws. And so as a provider, as an individual working in a long-term care setting, some of the things that we were doing, I was like, there's a more efficient way to do this. There's a better way. So my thought initially is, well, let's just change the policy because we know that there's a better way to do this. And I was told, well, we can't change the policy because the policy is based on this regulation and this regulation is based on this law. That's what I kind of learned along the way. And so as an attorney, as going through law school, you learn about, you learn about the three branches of government, but you learn how you engage government, how you talk to your legislators, how you share with them the impact of policy, how you engage with the regulatory agencies and which agencies are responsible for what parts, of practice, and how to share with them the information that is impactful in terms of their decision making, because some of them have never worked in long-term care. That's not their background, and so they won't have that insight unless they hear directly from those individuals that are, impacted. And so, as an individual that has worked, boots on the ground, worked in a facility, worked with residents, talked with family members, having the experience, knowing the impact, I think that my experiences are important to share with the right stakeholders. But if you don't know that process, you'll be in your community, in your facility, trying to make policies work where you, the operator, you, the individual caretaker, might have valuable information for the government, for the legislator, that could impact the way that those policies work or are written.
That makes complete sense. Like as you said, you learn the three branches of government, but being able to understand how they all connect together and how you change policy. Thanks for sharing that. I want to ask you kind of a positive situation, because I mostly speak about problems in long-term care and how people are overcoming it. I'm interested in what optimism you see from the national level. We're starting to come out of the pandemic. You're talking to a lot of leaders in 2022. Is there anything that you're excited that's about to happen in assisted living?
2022. So I would say the future in general. So I'll say optimism. I think, I talk to a lot of providers, and one of the things I think everyone is optimistic about is the ability to be able to come out of the pandemic. But I'll, be honest with you. I think that, our recovery within, assisted living and within long-term care in general is likely to lag what we see in the community in general. And I think that that is one important thing to be mindful of as we talk about optimism. But clearly seeing that things are changing, I think gives us hope for the future. Seeing that people are starting to feel more comfortable coming back into assisted living and having their family members come there to live in an assisted living setting, I think gives a lot of optimism. I think that it's important for us as assisted living providers to be able to restore our workforce. And so I think working towards initiatives that allow more workers to come into the long-term care space, and which will then allow more assisted living providers to be able to meet the needs of those that are in the community. I think that gives a lot of optimism. So I think everyone over the last couple of years has there's a level of I think exhaustion. And so I think the thought that, things are starting to calm down and go in the right direction, albeit slowly within our sector, I think gives people a level of optimism.
I just remembered when you were explaining that there was a personal question that I wanted to follow up on. I didn't. So thank you for your patience for allowing me to jump around all the time. LaShuan, you mentioned the word mentee and mentor about 10 minutes ago.
Mm-hmm.
I wanted to ask you, did you have a particular mentor professionally or personally in the last 10 years that affected how you are as a leader? And then I'm going to ask you, do you have any mentees underneath you that you're really excited about and you're even learning from them?
Oh, yeah. So that's a great question. So yes, I do have a mentor that I have a couple of mentors. So I will tell everyone out there that you're not limited to one mentor. People give you different things at different points in your life, and you should, stay connected to them. But I would say that my most, impactful mentor is, do I say their name or
Please
just tell
go
you about
ahead. Let's give them a shout out.
So I would say my most impactful professional mentor is Marie Quinn. She is a nurse, but she was a vice president in the organization that I work for just previously prior to coming to NCAL. She retired a little bit before me, but she said a couple of things to me. I mean, so many things. Oh my goodness, I could go on forever. But, she told me the importance of, mentoring, number one, about how important it is for me to bring people up, to show people my experiences. But I think also one of the things that I thought that she was an effective leader. She empowered people to put them in positions where they were able to leverage their strengths. And so one of the things I learned from her is how to look at where people are strong and let them do the things that make them strong, but also some awareness of where people are not strong and not giving them work that allows them to not excel. And so kind of focusing on their strengths.
Mm-hmm.
And so that was one thing I learned from her. She was a very effective leader. I think the other thing too, which can often, I think, be scary when you're in leadership roles where people are, rising and looking to excel. But she gave me lots of opportunity to to present my skills. And I would say my skills with air quotes around it, because I think she gave me a lot of I had my first opportunity to present information to a CEO and a COO. And maybe I shouldn't use those terms, but a chief executive officer or a chief financial officer. And I've never, that's not an area, that's not a room that I'd ever been in before. And so, she empowered me and said, you're the subject matter expert. You could give me the information and I could present it, or you could present all the information that you are very knowledgeable about and you have that ability. And so what I learned from that is that it's not necessarily always about the title that you hold, it's about the skills that you have. And so I'm the subject matter expert in whatever that area was. And so she really empowered me to kind of not minimize my contribution to an organization, but really elevated me by saying, you have those skills, you are the expert. And so that was something that I tell other people, because I think sometimes people are intimidated by titles like executive director or CFO or COO. And it's like we all have roles. Each role is very important to the big picture. And so we need to think about that our role is equally important. And it's not necessarily about the hierarchy of the title that you have. And so I think that's probably one of the most valuable lessons that I, gleaned from her.
That one's
Um,
good. That one's good. And I want to pause and reiterate what you said. You said it's not about the titles, it's about the skills. And that leads me into, do you have someone underneath you who has the skills and just doesn't have the title, and you know this person's going to be an important leader in our industry?
So in our industry, well, let me just say this: I definitely have mentored young individuals. So can I mention like?
See, please,
Okay,
yes. I
so
speak in Spanish.
there is a program. It's called the Year Up program, and they have affiliates in different states. I don't know all of the states, but I started mentoring in Philadelphia, and then I'm in Baltimore now. So started mentoring there as well. And so I still, keep in touch with all of my, mentees. They are not in the healthcare field because they didn't have a healthcare, track. But of course, that always gives me the opportunity to introduce them to,
Right.
healthcare, long-term care. So in terms of in the industry, um, let me think of who I've met. Oh, so yes, yes. Oh, okay. So now I had to think about like who would I? Yes, there's actually two people that I'm, thinking of that I've met along the way that do have the skills and really just need the opportunity. And so I'm going to just, pivot there because I think there's a message here for the larger audience, if you would let me to kind of pivot a little bit, because I think that's an important point. I I think that some of us are in a position where we have the ability to give opportunity to people. And sometimes that's all that people need in order to be able to demonstrate that, the sky is really the limit. And so I think that it's important for us to create opportunity where opportunity doesn't, exist. I think that's an important message within workforce, because as we're thinking about how to get more people, into the sector, I think the second point that I'll make about that is that sometimes, when we're in leadership roles, there is an opportunity for us to bring people up, similar to what Marie did for me, which is if people are doing the work, gathering the information, sometimes it's important to give them the opportunity to present it, to be the face, but also give them the skills so that they're able to do that. So mentoring is something that is extremely important to me. I talk about it a lot to people because I think that it's been impactful in my own life. And hopefully, the people that I've mentored feel the same way, that I've had some impact in their life as well, and opening doors. I'll tell you, I've had mentees that I've taken on congressional visits with me so that they have that type of exposure and that they're able to be in the room and see how it works. And so that it's not a scary experience for them if
Mhm.
they ever have that opportunity, again. So anyway, I know I went off tangent a
No, no,
little
no.
bit, but
I'm glad we're really getting into the good stuff. My last question as we start to wrap up here, and I'm going to let you choose which way you want
okay.
to take it, which is uh, anyone who works in long-term care, especially assisted living, definitely knows who you are, and they know who you are professionally. I'm going to ask you what's something that they might not know about you that would surprise them. So I'm going to ask you what book might be on your nightstand that would surprise them, or some Netflix show that you're watching today, or some podcast that isn't related to the industry that would give us an insight to what makes you laugh, what you listen to at home when you're a mom.
Sure. So I will say probably the first thing that comes to mind, and anyone that knows me, I am a fitness fanatic. I love to exercise. And I know that probably sounds weird, like who loves exercise, but I do, because it's something that's self-fulfilling. I get up at like 5:30 in the morning pretty much every day, and unless I'm traveling, and I work out. And even when I'm traveling, even when I'm on vacation, I work out. And then, so that's one thing. I think that's probably a huge part of my life is fitness. I work out a lot. And then there's a book that I just started reading, and I saw a friend of mine talk about it and how good the book was. And so I'm literally on chapter 2. Well, when I say reading, I mean listening to it.
Right, I understand.
Okay. And it's called Atomic Habits.
I'm reading it too.
Are
I'm reading
you reading
it.
it?
Yeah, it's in my Kindle. Yeah, I'm probably on chapter 2 as well.
It is really, really, it's so good. It's such a good book because it helps you kind of understand your thought process and why you are where you are in terms of, you know, uh, your outcomes. And so I'll tell you, I'll just say one of my biggest takeaways early on, I'm not done, is the importance of process over goals.
Mm,
And goals help you set the direction, but the process is really how you get there.
uh-huh.
And the author of the book talked about that if you can have goals, but if you don't have a great process, you won't get to those goals. But if
Mhm.
you have a really good process, even if your goals aren't, the best worded, you're gonna have a great outcome. And so that really, that was really meaningful for me. And then can I say one more thing
Yeah,
really quick?
please.
The other big takeaway from the book was about the importance of the small kind of wins, the small changes that happen. Because I think a lot of times we minimize those small changes. We don't get enough satisfaction from them. So we kind of give up on things that we're working on because we want to just see this big transformation. And it's like, no, those small, and he gives a lot of examples of how the small things add up to something big over time.
Mm.
And so that for me is really meaningful, especially as I'm in this new role, that it's not going to just be, things aren't going to just happen overnight, that I have to really look for the small changes, knowing that over time it's going to lead to something really big and impactful.
I'm thrilled that you brought up that book, and there's a sister book that's related to it that I think it's called Tiny Habits. And one of them, I don't remember which author, they have a free program that you can sign up online. It's a 5-day program. It helps you start changing habits and learn how to do that. Exactly what you said, which was process. And so I signed up for it about 2 weeks ago. And I think, I'll share this so that you can laugh. One of the ones that, and it was kind of setting up the trigger. When I do this, the next thing I do is this.
Mhm.
So one of mine was, when I drop off my 5-year-old at preschool in the morning, I get in the car, I start thinking about work, and I wanted to change that. I wanted to enjoy the moment. So I get in the car, I drop off my son, close the door, get in my car, and then I say out loud the things that I'm thankful for in life that day, out loud. That was one of
Yes.
the that I did. And the other one is, I'm on so many Zooms. I said, after every Zoom, I turn it off and I go do 5 push-ups. So those are my tiny habits that I'm trying to change.
I love it. I love it.
LaShuan, thank you so much for joining LTC Heroes. It was coincidence that we ran into each other in Georgia and able to put it together on the platform and get to know you, as a person and as a professional. Thank you so much for giving us time today.
Thank you so much, Peter, for having me.
I look forward to seeing you at the next convention.
Absolutely.